Have you ever noticed those small squishy bumps on the heels of your feet when you stand or put pressure on them? These bumps are called piezogenic papules, and while they might look concerning, they're actually quite common. But what exactly are they? What causes them? And is there anything you can do to get rid of them? Let's dive deep into the science behind these mysterious heel bumps. Also, real quick before we get started, it would mean the world to me if you hit the thumbs up button down below, and if you enjoy the content, subscribe and turn the bell on to stay up to date with new weekly videos. And if you know anybody who has these heel bumps, so what are these little fat balls and bumps on your heels? Well, the medical term is called piezogenic papules, piezogenic meaning producing pressure, and they are these soft, skin-colored, although they can be also slightly yellowish bumps that appear on the heels due to the fat tissue pushing through small gaps in the connective tissue. I'll throw up a diagram to make it easier to understand. This is a skin diagram. You see these fat cells behind the fibrous septa. Well, these fibers here keep the fat in place, but when there's a lot of pressure, they burst through them and cause visible bumps on your heel. And they aren't that big either, ranging anywhere from a few millimeters to a centimeter. And when you press your heels down hard against the ground, you can see them kind of bulge a little bit, but it's interesting because usually they disappear when you lift your foot off the ground. And oftentimes you don't realize you have them because they aren't painful and they aren't tied back to any major diseases or underlying conditions and are actually normal. Roughly 76% of Americans have them, and it might be your first time noticing them if you're watching this video. But I will say there may be an association with Prader-Willi syndrome, and around a third of people with Ehlers-Danlos syndrome have them. But in these cases though, the bumps are actually painful because of the weakness in collagen for these folks. If you're experiencing pain with them, I would discuss it with your doctor. But you might be wondering, who is at more risk of developing these heel bumps? Well, it's going to be people who are frequent runners, jump rope often, dance, and even figure and ice skaters, as they are said to be more prone to them because they put a lot of constant repetitive pressure on the heel. They can also occur in folks who have careers where they stand for long periods of time, like chefs, for example, especially if the chefs aren't wearing good shoes. Let's talk about treatment. What can you do to get rid of them? Now, I will say most people do not experience pain, and since they are normal, the condition is primarily a cosmetic concern. You might just not like the way it looks. So if that's you, here are some things that can help. The first is to reduce pressure on the heels. This means avoid standing for long periods or use cushioned insoles in your shoes to distribute the weight more evenly. And with that said, you want to have shoes with proper arch support and are shock absorbing. Sometimes this could do the trick. Look for a shoe that has a deep heel cup. You see where the heel can fit snugly in and can also provide stability? Those could do wonders. You can even take it a step further by wearing compression stockings to help keep the fat tissue in place and prevent them from getting worse. Dropping BMI can also decrease pressure on the heels too, but they form from any kind of BMI fluctuation too, up or down, which is why it can be tricky sometimes. So don't be alarmed if they look more noticeable when you drop weight too. You'll notice at some point they'll disappear and come back on their own, which can be normal as well. And the best thing you can do is that when they do go away, be more mindful of where you place your weight when you're standing. There are some rare cases in which a podiatrist may suggest steroid injections or even a minor surgery to the heel if they deem it necessary, but again, that is rare and is more associated with the painful papules that come with it. If yours aren't painful, then you're okay. And there you have it, guys. Piezogenic papules they're generally harmless, but if you experience persistent pain, swelling, or signs of inflammation, it's a good idea to see a podiatrist that can help rule out other conditions that may look similar, like plantar fasciitis, lipomas, or cysts that may look similar but require different treatments. And I'm more curious to hear from you guys now. What's your story with them? Do you have any tips and tricks that has helped you? Or maybe you just noticed that you have them right now? Write them in the comments below, and if you found this video helpful, give it a like and share it with someone you think can benefit from it. And until then, guys, if you did enjoy this video, check this one out on dry and cracked heels, and I'll see you on the next one.